therapeutics of viral hepatitis and the hepatic encephalopathy. Before going to the actual cases, I just revise the drugs which are used in the management of viral hepatitis and the encephalopathy. Encephalopathy, I already discussed in the lecture, but I have to revise the viral hepatitis. The drugs which are used in the management of acute hepatitis B virus includes, if there is acute hepatitis B, generally the no treatment is needed because most of the cases, near about 95 to 99% of the cases, resolve spontaneously, automatically. And if there is a severe and the sudden hepatitis B infection, we can say fulminant acute hepatitis B, which is also termed as sudden or severe hepatitis, then we have to treat the acute hepatitis B infection. Now, what are the indications for the therapy for acute hepatitis B? If INR, international normalized ratio, if it is more than 1.5, coagulopathy, it is generally used to measure the prothrombin time, and INR is indicated international normalized ratio. If the bilirubin is more than 10 milligram per deciliter, so it indicates it indicates the marked jaundice for more than 4 weeks after the presentations, is an indication for the acute hepatitis B viral infection. What is the treatment protocol? Treatment with nucleoside analog entecavir. Generally, entecavir is commonly used in the management of hepatitis B viral infections, including acute and the chronic. So it is generally also act by the reverse transcriptase mechanism. So entecavir is reverse transcriptase inhibitor from the nucleoside category. Nucleoside. Interferon is contraindicated because of the risk of increasing hepatitis in the acute hepatitis B viral infection, and the endpoint for the treatment of the hepatitis B viral infection acute, you had to check the hepatitis antigens. If the antigens are negative, it's an indication for the endpoint for the treatment. What are the indications for the chronic hepatitis B viral therapy? If in the chronic hepatitis B virus infection, if the DNA, hepatitis B virus DNA is more than 20,000 international units per ml, or more than 105 copies per ml, it indicates the treatment or therapy for the chronic HBV. If the liver biopsy shows moderate to severe acute necroinflammation and or moderate fibrosis, indication for the chronic HBV therapy. If serum enzymes, liver enzymes, if the severe ALT, that is alanine transaminase, is about 2.5 times above the upper limit of normal. It is an indication of the chronic HBV therapy. And patient with cirrhosis and plus HBV DNA positive is also an indications for the chronic HBV therapy. Which are the drugs are used in the management or treatment of this chronic hepatitis B virus infections? Generally, interferons are used. Interferon, in the short form, you can write INF alpha 2A, interferon alpha 2A, and also pegylated interferon alpha 2A, and pegylated interferon alpha 2B are available to treat chronic hepatitis B virus infection. What are these interferons? Interferons are the naturally occurring protein and glycoprotein synthesized by host cells in response to various inducers, including viral infections, tumors, and other biological inducers. So we can say the interferons are the endogenous protein, endogenous substance which is synthesized by our host cells or humans body cells in response to the viral infection. So they protect us from the viral infections. So we have to use this interferon alpha 2A and alpha 2B in the treatment of the chronic hepatitis B virus infections. What are the pegylated? Pegylated means PEG, polyethylene glycol. It contains the interferon with polyethylene glycol, and which increase the duration of action and decrease the frequency of administration of the interferons. We will see in the next slide. Apart from the interferons, there are also nucleoside and nucleotide analogs are used. The nucleoside, what is the difference between nucleoside and nucleotide? Nucleoside without phosphate group and nucleotide with phosphate group. This is a chemical difference between nucleoside and the nucleotide. They inhibits the enzyme reverse transcriptase and inhibit the DNA synthesis, inhibits the viral replications and decrease the viral load. Which are the first choice of the drug in the treatment of hepatitis B virus infections? Entecavir. Entecavir, Entecavir is the first choice of drug which is having high efficacy and the less resistance, because the most of the cases the resistance is a big problem, and if the resistance develop to the commonly used drug, it will be create problem to the management or to treat the viral infections. So entecavir is the first choice of the drug in the management of hepatitis B virus. Others are the telbuudin, which is having high efficacy and high resistance. Resistance is high in the telbuudin. So suppose if the patient is taking telbuudin from the long time, and after some time, 1 year, 2 year, there is no response. So telbuudin, it is having more resistance. And lamivudine, Both telbuudin and the lamivudin is having high resistance. So which is the most important drug here? Entecavir. Second one is nucleotide with phosphate group reverse transcriptase inhibitors, and it is tenofovir. And it is also first choice of the drugs because it is having the high efficacy and no resistance. And second drug from this nucleotide category is adifovir, which is having the less efficacy. So if there is a question in your MCQ, which of the following nucleotide reverse transcriptase inhibitor is the first choice of the drug in the management of hepatitis B virus infections? So you should know if there is a tide, T for tide, T for tenofovir. Remember T for tide, T for tenofovir. And if there is a question, which of the nucleoside reverse transcriptase inhibitors is a first choice of the drug in the management or treatment of the chronic hepatitis B? Remember entecavir. Entecavir, nucleoside, tenofovir, nucleotide. Now the interferon, how they act, interferons. Interferons bind to the specific cellular receptor, stimulates the transcription of the specific gene, synthesis of protein that contributes to the viral resistance. In addition to the antiviral effect, interferons also have immunomodulation effect because it is indigenously produced protein and the glycoprotein in our body. What is the therapeutic role of the interferon? It should be indicated in the young patients, maybe less than 50 year, with well compensated liver disease. If the patient having decompensated liver disease, you cannot prescribe interferon as it will create the more adverse effect to the liver. So if the patient is less than 50 year and the liver is well compensated, you can give interferon. Or patient do not wish to be on the long term treatment. Yes, very important because the duration of treatment with the interferon is low as compared to other antiviral drugs. Or example, if the patient is the woman and she is planning for the pregnancy, so patient planning to be pregnant within the next 2 to 3 years, you have to give interferon because the duration of the treatment is less. What is the duration of treatment of interferon? If you are giving only interferon, 16 weeks. And if you are giving pegylated interferon, you have to give 48 weeks. But what is the advantage of this PEG, polyethylene glycol interferon? You have to give weeks one dose. A dose, only one dose per week. So you have to take total 48 dose of the pegylated interferon. While for the normal interferon, 16 weeks, but the dosing frequency is too much high. It is not a weekly dose, it is required daily dose. So the best way, use the pegylated interferon, one dose for 1 week, total 48 weeks. So 48 weeks means within 1 year. Within 1 year, treatment can be completed. Pegylated interferons, these are the recombinant interferon attached to polyethylene glycol. Obviously, the recombinant terminology you should be familiar with is recombinant means we have to we are not able to get the endogenous interferon. So in that case, we have to use recombinant technology to produce endogenously interferons. What are the advantage? Slow absorption. Which interferon? Pegylated polyethylene glycol. Slow absorption decreases the clearance, higher and more prolonged serum concentration that enable once weekly dosing. Obviously, the most important drug also having, or the best drug always having the adverse effect. So which are the adverse effects of the interferons? Flu like illness, that's a fever, chills, headache, myalgia, and these are the common adverse effects of the interferons. What is the safety during pregnancy? It is a category C. Use with caution if benefits outweigh risk, because the animal study shows the risk. And interferon should be contraindicated in the person of the acute or in the patient of the acute liver failure, decompensated cirrhosis, or if the patient is having decompensated liver cirrhosis, autoimmune disease, psychiatric conditions, and the pregnancy, because they will exacerbate this psychiatric condition, autoimmune disease, and liver cirrhosis if you prescribe the interferon in these conditions. What are the black box warning? If you prescribe to the psychiatric patient, neuropsychiatric conditions will increase, autoimmune disease, and also ischemia and infectious disorders. So this is about the interferons. This is about the entecavir, tenofovir, same. The drugs used in the treatment of acute viral hepatitis C. Now this was up to the B. Now what is about C? You can use pegylated interferon alpha 2A, alpha 2B in the treatment of acute viral hepatitis C. What is the dose for the pegylated interferon alpha 2A? Is near about 180 microgram per week is the best one. Or if you are using alpha 2B, 1.5 microgram per kg per week. So this, it is available in the low dose as compared to alpha 2A, and the duration of treatment is only near about 3 to 6 months. So these are the drugs which are used in treatment of acute viral hepatitis C. We are not using interferon in the treatment of HBV acute infection. Again, please take a note. We are not using interferons in the treatment of acute HBV infections. We are using the interferons in the treatment of acute HCV infections. So this is the difference between the B and C. Let us see the treatment of chronic viral hepatitis. You can use interferon alpha 2A, alpha 2B, pegylated interferon alpha 2A, alpha 2B, and only plain interferon available as alpha 2A. And the antiviral drugs are available: ribavirin, sopasvovir, and the ladipasvir. But the most commonly used drug is ribavirin. Ribavirin is the used in the treatment of the chronic viral hepatitis C. If there is a questions for your MCQ, which of the following drug is useful in the management of HCV chronic infections? So remember ribavirin. We will discuss what is ribavirin. But before going to the exact cases, there are the recommended hepatitis C virus combination dosing. If the patient is from the Europe, North America, Saudi, Egypt, and Africa, and if the patient from the Europe and North America, it is considered as genotype 1. If the patient from Saudi, Egypt, and Africa, it is considered as genotype 4. If the patient is from the China and Asia, considered as genotype 2 and 3. So let us see the patient from the Europe, North America, Saudi, Egypt, and Africa. The drugs used is pegylated interferon alpha 2A. The dose is 180 microgram per week and duration 48 weeks. For antiviral drug ribavirin, the dose is 800 to 1200 milligram per day orally in two divided doses. So you have to give the ribavirin two times per day and plus pegylated interferon alpha 2A weekly for the treatment of hepatitis C virus infections for the patients from coming from the Europe or not coming, the patients from the origin of Europe, North America, Saudi, Egypt, and Africa. What is the difference between this genotype? If you see here duration for the China and Asia, only 24 weeks duration is needed. So this question may be for your MCQ. What is the maximum duration of treatment for the hepatitis C virus infection if the patient having genotype 1 or 4? Or we can say the patient, Egyptian patients with hepatitis C virus infections, what is the maximum duration of treatment of the pegylated interferon alpha 2A? Your answer should be 48 weeks. And if the patient from the China or Asia, what is the maximum duration of the treatment of pegylated interferon alpha 2A? Your answer should be 24 weeks. And the ribavirin dose is 800 milligram per day orally in two divided doses. What are the precautions? Strict birth control in patient treated with pegylated interferon alpha 2A and ribavirin during therapy and the 6 month following, because the wash out time from the body is minimum 6 hours. The amount of drug should be totally removed from the body. So ribavirin generally inhibits the viral protein synthesis and it is the nucleoside analog. Soposbuvir, it is nucleotide analog. Haroni is a combination of the Levipasvir and Sofosbuvir, and the most important one is the types of recombinant vaccine. There are two vaccines are available: Recombivax HB, available in the 10 microgram per ml for the pediatric and adult patient, and Energix B, 20 microgram per ml. It is only available for the pediatric use. What is the dose? It is given intramuscular in deltoid muscles, three doses at interval of 0 after 1 month and 6 month, three doses. And if his adult is more than 20 years, the full dose is required. About 20 years of the patients, 1 ml dose is required. And if the patient is from birth to 19 years old, only give half of the dose, zero point 0.5 ml. The vaccine gives protection ranging from 6 to 12 years, and there are some adverse effects like the pain, fever, local hypersensitivity, and the flu-like symptoms. So this is all about the initial information about the hepatitis B, C virus infection treatment. Now we will see the exact cases. We will see the exact cases. Just a minute. Case 1: a 20-year-old woman who is hepatitis B antigen positive, hepatitis B E antigen negative. Her hepatitis B V HBV DNA is 1.2 million copies per ml, and it is approximately 250,000 international unit per ml. She had mild portal inflammation, no fibrosis. Her serum ALT is 60 international unit per liter, and the upper limit is normal 40 international units per liter. What is the plan of management of these patients? Now the age is 20-year-old women, and hepatitis B antigens are positive, and there is slight increase in the DNA copies. Only mild portal inflammation but no fibrosis, and